Good morning. I see people are jumping on. I'm gonna give it a few more, maybe another minute just to make sure. Hello, thanks for saying hi. I never want to wait too long because it immediately starts recording, so I feel a little silly sitting here staring at the screen as it's recording me. But let's give it a few more seconds. How is everybody? Okay. Let us begin. Good morning. I am Dr. Lindsay Nelson. I was actually trying to go to sleep last night, and I was thinking about how I want to change my webinars to be something more like Captain's Log, except it would be, Dr. Lindsay Nelson, review of her week. And I probably should work on the name. It's probably not very catchy, but it seems like these webinars are kind of coming up with them based on what I'm seeing over the week. And I would say my last week was predominated by a lot of long-time patients, 10 plus years, where over the years we've treated various complaints, but something always crops up. And my belief with those patients is at the heart of what's cropping back up is stress. Over the months with you guys, we've talked a lot about inflammation being at the heart of most disease processes. And stress plays a big part of that inflammation. I was thinking about, take a gas stove. Gas is the inflammation. But in order for the stove to turn on, something needs to be ignited, right? And that, you push the igniter and you get a flame. And to me, stress is that igniter. And so they really do go hand in hand. And sometimes it's hard to tease them apart. Unfortunately, stress has become such a commonplace in our civilization. Everyone has stress, so stress equates to something, being normal, like you can't live without it. And we've really minimized it. It's just a word, it seems like, and we associate it with more of a feeling, right? And stress is anxiety, stress is fatigue, stress is, getting, worked up or something like that. But instead, it's actually a physiological process causing a series of events in the body. So stress can get ignited from chronic pain, inflammation, illness, lack of sleep, blood sugar dysregulation, infections, or it could be chronic mental emotional stress. They have actually found that those nagging day-to-day stressors, like being homebound or traffic or whatnot, cause more issues with your adrenals than the big stressors, divorce, death, etc. And so what happens in your body is your adrenals release cortisol, and cortisol, we call it your fight or flight hormone. And whether in this situation, you choose to fight or flee, regardless, your body is saying like, it's time to kick it in high gear. And so if you think about it from that perspective, that means your heart rate increases, your blood pressure increases, your respiration rate increases, blood gets shunted to major muscle groups and away from your digestion, so digestion starts to turn off, and then we release stored glucose into the blood, so we have that quick available energy. And we also start to think in the back part of our brain, more of the mammal part of our brain, versus in the frontal cortex, where there's more about reasoning and judgment, that type of stuff. So the symptoms that we can see are quite varied. I would say fatigue is super common, whether that is a lot of high energy and then feeling like they have to crash. I would say mid-afternoon crashes are really common. A lot of patients will talk about how, they sit down in front of the TV and they pass out. Weight gain is common, especially around the midsection, you know, that kind of spare tire that people talk about. And that has a lot to do with that insulin being released. Underlying chronic infections, such as like chronic sinusitis, bronchitis, illnesses, viral breakouts, herpes, that type of stuff. We see a lot of insomnia, can't go to sleep, can't stay asleep, wake up tired, people who need to have like naps during the day. Allergies are big, muscle and joint pain or weakness, mood swings, anxiety, depression. A lot of people talk about feeling like their memory isn't as sharp as it used to be, or they'll say something like foggy-headed feeling. We start to see bone loss, hypertension, loss of skin elasticity or easy bruising, thyroid disease, autoimmune disease. These are all symptoms of underlying stress. NDs have looked at adrenal fatigue, stress for decades. MDs generally only think that there could be two things wrong with adrenals. It's one of two autoimmune conditions, Cushing's or Addison's. But naturopaths, most of the time are dealing in the realm of functional medicine or clinical medicine. So that's why we think testing is important. And why, if you were to ask your PCP, they probably wouldn't test. Or if they did, they would do a random cortisol level, but that doesn't illustrate what your cortisol levels are or what your adrenals are actually doing, because your cortisol is on a circadian rhythm. It's high in the morning and low at night. The majority of the time it competes with melatonin. So there are a lot of patients that I see where their cortisol levels are high at night, and so their melatonin levels can't turn on and get high enough to really get you into that deep sleep. Salivary testing, you have multiple points during the day where you are collecting your saliva, and that allows us to map your cortisol over a day. It also looks at other key diagnostic points that can be abnormal when your cortisol levels are off. For instance, insulin. When we are under stress, we release stored glucose into the blood, and we start to see these blood sugar spikes. And then your body says, oh, that's too much, and then it takes it back. Chronic stress resulting in elevated cortisol levels may counteract insulin and lead to what we call functional insulin resistance. We need insulin to grab sugar out of the body and put it into your cells, right? That's where you get your cells get their energy from. And so when we see insulin resistance, even if it's more on a clinical reference range, we start to see diabetes or symptoms of prediabetes, such as like the weight gain and the joint pain and the nerve pain and that type of stuff. The salivary test also tests your DHEA levels. This allows the physician to see where in the kind of stress response spectrum the patient is. Maybe they're just in the alarm phase. Maybe they're having a lot of like cortisol bursts, but it's not really affecting, causing long-term elevations. Maybe there's a resistance. So with that, when we have elevated cortisol levels, those cortisol needs to get into the cells to do, cortisol is also really important. It's our natural anti-inflammatory. And so what we need is cortisol to get into the cells to do its natural anti-inflammatory work. But when we're constantly being exposed to cortisol, those cells become less receptive to it. And so what we see is cortisol resistance, a lot like insulin resistance. Or the patient could just have exhaustion and they're not producing enough cortisol. DHEA is also really important for women. It's our biggest source of testosterone. Testosterone for women helps us feel really grounded, not so many mood swings, helps with our libido, helps with putting on muscle, etc. Helps strengthen our bones. Normally this test runs between like 150, 190 to even like 400 depending on the company. Diagnostics is running a special through September 30th where the ASI is only $99. So anyone who is curious about it, please contact me. I can get you set up. They can drop ship the kit to you. You collect your saliva, you pay them directly, and then I will get the results and we can review them. But what do I do when I get that information? There's a lot that NDs can do. I think, an area where NDs can really shine. Maybe it's using adaptogens. Those are herbs that are supportive for the adrenal glands. They don't necessarily increase your cortisol. They don't decrease it. They just help support them. There are things that we can do to help lower your cortisol levels, especially at night if it's competing with melatonin. We have herbal support that can help increase your cortisol levels. Maybe we need to address the underlying insulin. Excuse me, maybe it's counseling, maybe it's meditation, mindfulness, maybe it's creating a full diet and lifestyle makeover. With these patients that I've been seeing over the week that got me thinking about this, sometimes it's a lot of coaching. That's what I've been doing a lot this week, where I'm asking patients to really look at what's creating that chronic stress and how can they choose to uncouple from it. Because no matter what, I can treat the current condition, but if stress is unresolved, it's gonna find another outlet. And so that is my brief little synopsis on adrenal stress. Does anyone have any questions? You can chat. I don't think you can unmute yourself, but if you have a chat, if you want to type something in the chat box, please do. I know I went through that quickly. Can I see? Nothing? All right, well, thank you all. I appreciate you being here. Especially I've seen a lot of same names each week. It means a lot to me. As always, you will find a copy of this on my website, drlindsaysnelson.com. Or if you have any questions, please email me at drlindsaysnelson@gmail.com. Last chance, any questions? Okay. Bye, everybody. See you next week. Thank you.